I'm Alexandra. My condition is called neurofibromatosis type 1.
It's like a cape.
She has neurofibromatosis, a hereditary genetic disorder that affects the nerve tissue.
Neurofibromatosis has two different types. There's type 1, which is what this young woman has, and type 2. Type 1 basically is what you see in most people. It's about 1 in every 3,500 births has neurofibromatosis type 1. And this is characterized by typically benign growths or masses that occur in the skin and along different nerves. Usually these masses are quite small. Hers obviously ain't small.
But this almost looks like a cape. I've just never seen it grow in this manner. The morphology is very unusual.
I've seen a good amount of neurofibromatosis, and I too have never seen anything like this. These are huge masses. Usually neurofibromatosis are smaller masses that occur all over the skin, in the body. They're usually not that large, but for one to get this big is really, really unusual.
Each of these weighs 7 to 10 pounds.
And like 15 years ago, each side was just like a hazelnut.
These growths have obviously expanded in size exponentially. Now, about half of the people who have neurofibromatosis inherit it from their parents in an autosomal dominant fashion, meaning that if you get that gene from your mother or your father, you will get neurofibromatosis. So it's like a 50-50 shot based off of your parent. The other 50% of people who have neurofibromatosis typically are believed to have had a mutation in their genes, creating this condition. Essentially, they get a mutation in a gene that prevents suppression of tumors in their body. Therefore, they get these masses that appear sometimes all over the place.
It's almost like she's got
like somebody's
a rope
like
around
here.
her neck.
Yeah.
So it's pulling on her larynx.
Can you imagine having about 15 pounds of weight hanging from literally a rope that's kind of attached to your neck itself? The question that I have in this situation is, it's gotten so large, why hasn't somebody treated it before?
Why didn't they try to remove it when it was smaller?
We didn't use it. There's no connection between the thoracic or the spine.
The doctors there said that they weren't sure if it was connected to the spine.
Yeah.
Whenever I have patients see me and they've got, let's say, a mass in their back, and oftentimes it seems like a lot of times it's right along the midline, meaning that it's kind of centered over their spine, I will always get some type of testing to make sure that there's no connection between that mass and the actual spinal cord.
It's gonna be a breeze.
The worst case scenario is a doctor could just go in surgically, start making cuts, and the next thing you know, there is a connection between the spinal cord and that mass, and now you've cut through parts of the spinal cord or the covering of the spinal cord, and you've got a leak of fluid.
Things are going very badly.
All of this could be a complete disaster, and so you definitely want to get imaging to make sure that that's not going to be a problem. The ideal eye cream should be hydrating, but also contain retinol to support the production of collagen. My Youn Beauty Retinol Eye Cream is just that. Also containing caffeine for an instant tightening effect, this eye cream is a must for anyone concerned with aging eyelids. Check it out at younbeauty.com. There's a link in the caption below.
Our goal today is going to be to take off this massive weight that's pulling her neck and back down and try not to lose too much blood.
So I'd have to assume that the good doctor got some imaging already, and that imaging showed no connection between the spinal column or the spinal cord and those huge masses. If there is no connection there, then it should be a relatively straightforward operation to essentially lop off the connection between the body and those huge masses hanging from her back or the back of her neck. Now, that operation technically has two steps to it. The first step is to very carefully cut those masses out to remove that kind of connection, that kind of cape, I guess, that she has. And then the second part of it is to reconstruct or close everything up so that everything is now flat and it's going to heal fine without any exposed bone or other type of tissue.
On the left side, it's running down to the upper back, but on the right side, it's really attached to the shoulder and the side of the neck.
So the way that I would approach this type of a procedure would be to stay quite superficial, meaning staying just underneath the skin as I cut this tissue out. Where the risk lies is when you go deeper, when you go closer to the shoulder girdle, when you go closer to the muscles of the back, where you could potentially create more bleeding, you could damage the muscle underneath, or even nerves.
So I'm gonna try to see if we can elevate the bulk of this mass.
In order to minimize her blood loss, we're going to raise the tumor above her heart.
That is a really good idea, because what you want to do is make sure you limit bleeding. Okay, if you've got your heart pumping blood and you've got a part of the body that's basically superior to it or above it, you're going to get less blood that's getting pumped into it, so you're going to get less bleeding with the operation. In addition to that, by putting it on that what we call Mayo stand and elevating it, it allows that skin bridge to stretch out so that you can see it better and ideally cut it in a more controlled fashion.
We've got the wrapper on it. We're strangulating this thing. We've got gravity on our side, but this little guy here is saying it's not over till it's over.
Masses that huge have to have huge blood supply. So there are probably very large blood vessels, both arteries and veins, that are going from her body into those masses in order for those things to grow as big as they have. That means that if you just kind of go in and you're just lopping things off, you could get a ton of bleeding. She could lose so much blood that she may necessitate transfusions. And so in these types of surgeries, going very slow, methodically, stopping the bleeding right as you get to it is going to be the key. And a lot of times what we do in these situations is we can actually very closely and very carefully cut right up to the blood vessel. We take a large blood vessel, and I see these in surgery all the time, you tie them off and then divide them, not allowing them to bleed at all.
So we're done. Finally, overall the surgery went very well. Controlled the blood loss. It was not attached to the spinal cord. It was a total success.
That is great to hear, because these types of operations where you've got a patient with a very unique problem, oftentimes you really don't know what you're going to get into. Now, once again, I hope that he got some imaging prior to the operation, because that's going to be key to know that there's no unusual structures or unusual anatomy that you could be surprised with in surgery that could cause major problems. The planning of an operation like this is just as important as the actual act of operating.
It feels so much joy now. I imagine how might it be without the tumor, and it's so much better than in my dreams.
What a fantastic result by this great doctor. Now, she had these two huge masses that are hanging from her neck, but what about if you take one of those and you hang it off the side of your face? That is this gentleman that I react to in this video right up here. You gotta check out how that comes off and how he looks afterwards. And as always, remember to eat real food, use clean skincare, and auto-juvenate before you operate.